This, by the way, is one of the ways the pathological mourning that's avoiding loss, that's the way it presents itself later in life. I'm still thinking about the question that I said earlier that I imagine you were asking. Okay, if there's pathological mourning, how do we know this? How does it present itself? This is the way it presents itself. Earlier traumas, earlier relationships get reenacted in the present. Hello, I'm Dr. Anthony Mazzella. Welcome to our continuing education seminar series on understanding and treating the challenging personality disordered patient. Throughout this comprehensive program, we will delve deep into the various facets of personality disorders with a particular focus on narcissism, examining each facet from different psychodynamic perspectives. In each one-credit seminar, we will explore a particular challenging or narcissistic trait, think about its origins, and finally, through case examples, how to treat the specific narcissistic trait under discussion. This comprehensive approach will lead to more effective treatment outcomes and healthier interactions. In this seminar, we will delve into the complex phenomena of, and I quote, trauma bonding, a psychological pattern where individuals form intense attachments to manipulative and abusive relationships despite recognizing the harm. Our exploration will cover the following key goals. 1. Understanding trauma bonding. We will examine how trauma bonding serves as a defense mechanism against a lack of vitality in the early parent-child relationship. 2. Pathological mourning. I will attempt to illustrate the significant role pathological mourning plays in the creation and perpetuation of these toxic, trauma-bonded, or sadomasochistic relationships. And finally, 3, emotional voids. Our exploration will reveal how the trauma bond acts as a desperate attempt to fill emotional voids, striving to revive a sense of connection and vitality within the confines of toxic relationships. By the end of the seminar, you will gain a deeper understanding of the dynamics of trauma bonding and its profound impact on your patients and their relationships. In conducting a thorough review of the available social media content, it became apparent to me that a substantial body of work predominantly addresses the descriptive aspects of what is known as the trauma bond. Without delving too extensively into the well-covered terrain, I'll provide a brief overview of the trauma bond, or for those who aren't familiar with this relationship dynamic, a brief introduction. What characterizes a trauma-bonded relationship? This relationship, also known as a toxic relationship, typically is a pattern where a person is bonded in a relationship that's characterized by manipulation, invalidation, emotional, or other forms of abusive behavior. Despite knowing that this person continually hurts you in the same or in similar ways, you feel a sense of hope that things are going to change. And I quote the word hope and I emphasize it because we need to come back to this critical factor. But I'll do that in a moment. Why do individuals feel stuck in trauma-bonded relationships? I want to use a clinical example to illustrate this point, that they feel stuck precisely because they continue to hold on to hope. There's that word hope again. The hope is that the relationship will eventually meet their need for validation, recognition, and love. Also, they get stuck in this negative loop because they know that when, like, if they detach from this toxic relationship, and I quote, that they don't feel whole. I put feel whole in quotes because this is what I've come across in the social media content. They don't feel whole unless they are with this person. Since they don't feel whole, or since they feel depressed, they are vulnerable to finding their way back into the toxic relationship or in another relationship that is equally as toxic. Now, let me just do a quick digression on that note, because there's this other concept that's very common in the literature. If you're looking up narcissistic dynamics, it's called hoovering. Hoovering is thought of as a narcissistic manipulation where the narcissist in the relationship sucks you back in. I would encourage you to consider, if you have a patient that's in a trauma-bonded toxic relationship and cannot get out of it, that they are not just being, and I quote, hoovered back in. They're not just being sucked back into the relationship. What I have discovered is when you don't feel whole, right, you are then vulnerable to this hoovering. In other words, you're vulnerable and susceptible to getting pulled back in. You see, it's a very subtle difference, but in terms of treatment interventions, which we'll talk about, I'm always thinking about interventions. This subtle difference, this line of thinking opens up another pathway to understanding this complicated relationship. Instead of focusing on the narcissistic partner who pulls you back into the relationship, you may also want to listen for those inner feelings of emptiness. And I'll go into this more in a moment, again, through a case example. But what I'm suggesting now is that you listen closely for the hope and the patient who does not feel whole or feels depressed when they are out of the toxic relationship. Okay, so let's delve a little deeper into why these patients often remain in or return to abusive relationships. It now becomes imperative to explore beyond the description of what keeps them involved in these relationships. We need a more comprehensive understanding of the factors that perpetuate these individuals' engagement in trauma-bonded relationships. Let's now look more deeply as what earlier I said keeps these individuals attached to or involved in these trauma-bonded relationships. Just a very quick review. A moment ago, I said the relationship is characterized by manipulation, invalidation, emotional or other forms of abusive behavior, but the patient feels a sense of hope that things are going to change, and simultaneously they feel stuck because when they try to extract themselves from the toxic relationship, they don't feel whole. Examples always help bring things alive. So let's get right into a clinical example to demonstrate these dynamics and illustrate how, in my field, the field of psychoanalysis, how we would understand and work with these trauma-bonded patients. Just a very quick disclaimer alert. When I give clinical examples, we will explore authentic personal stories, but in order to protect the anonymity of these individuals and of my practice, the stories are always a mix or a synthesis of different experiences that I've seen online or within my own private practice. Take the case of a woman I will call Mary. Mary grew up with a verbally abusive, alcoholic mother who, she reported, constantly devalued her, called her stupid, a loser, and told her she was not going to amount to anything in her life. There are different types of, and I'm air quoting here, alcoholic mothers, but in this example, Mary's mother would start drinking around noon, which meant she was already intoxicated when Mary returned home from school. Let's pause and think about this, because already we have quite a bit of information. I like to draw upon psychoanalytic theory to shed light on the connection between trauma bonding and, in my field, what we call sadomasochistic relationships. According to the psychoanalytic theory, trauma bonding shares parallels with the dynamics found in sadomasochistic relationships. That's why I'm pulling in this concept. Both relationship dynamics are intertwined with unprocessed early losses, whether it's the loss of a parent, the erosion of parental love due to neglect or abuse, or the profound loss of one's own sense of self. These unacknowledged losses often serve as the foundation for the intricate web of sadomasochistic dynamics. So yes, what I'm suggesting, just to be very clear, that trauma bonding or sadomasochistic relations in part have to do with unprocessed loss. I'm going to keep going, and I'll build on this to try to demonstrate what I'm talking about when I say unprocessed loss, because I imagine this might be a little confusing at this moment. If there are unprocessed early losses, the trauma bonding relationship, akin to a sadomasochistic dynamic, may be viewed as a kind of pathological mourning. According to Shelley Bach, that's a renowned psychoanalyst, a sadomasochistic instead of a real and loving relationship develops when there is, as Mary described with her mother, parental non-recognition, emotional abuse, or a lack of mutual pleasure between a parent and a child. We can hear this in Mary's description. From very early in life, what she experienced would be considered a profound loss. She didn't have a mother who was attentive and caring and there for her. For Mary, this was too overwhelming for her to process. Because who does she have to turn to with these really complicated feelings? We don't hear anything in her story that she has someone with whom she can confide and someone who can help her process really complicated feelings. Just to return to our initial question, why do patients get stuck and remain in trauma-bonded relationships? If a loss, I'm tying this back to pathological mourning, if a loss cannot be processed, that's if someone's not there to help you sort through and make sense out of all these different feelings, one way to manage these painful feelings is to flee from them or deny them. One can deny the loss. One way to deny the loss is to create the attachment. You know, like what was the attachment Mary had with her mother? It was based on a sadomasochistic struggle, the constant devaluation. There was constant fighting, right? So what I'm suggesting is a way to avoid painful feelings is to create an attachment to a sadomasochistic struggle. Now, I know this must sound strange, but let me keep going. Bear with me. I'm going to explain this in more detail, but let me illustrate this point. Deeper exploration with Mary revealed that, and I quote here, "When my mother screamed at me," and here's the quote, "I felt like I had her exclusive attention." Mary's words. What does her mother screaming at her have to do with evading or denying painful feelings? Right? What does this have to do with pathological mourning, you may be asking? The screaming mother, or when Mary is being punished, there's no loss. What do I mean? She has her, and I quote again, exclusive attention. She has her attention in the form of what? Abuse or devaluing comments. But nevertheless, I've been told, and I quote again, negative attention is better than no attention at all. So when engaged in this kind of toxic relationship, when she's getting exclusive attention, guess what? She no longer feels all alone. She no longer feels empty. When a caregiver is emotionally absent or is abusive, I have discovered this leaves an intolerable, painful void of loneliness and emptiness or worthlessness. It's different for each person. I think you could fill in the blank here, but there are painful feelings that must be avoided. That's the main point. If you don't have someone to help you process these feelings, like I mentioned earlier, you have to avoid them. How can one avoid these painful feelings? To get rid of this void, these individuals turn to excessive or compulsive behaviors to stimulate oneself and keep oneself feeling alive. These are the people that are always busy, always entertaining. They need to be around people, right? So there are many ways one can avoid a painful feeling, but the main point that I'm trying to make is there's a repetitive attempt to disavow a loss or to repair the loss, as I said before, in the screaming or abusive behavior, in the devaluation. Again, I quote, "At least now I have her exclusive attention." This is what I referred to earlier. This is the pathological mourning. I hope you're beginning to get the sense that there's no mourning here. There's no giving up. There's no recognizing something and slowly giving it up and coming to terms with a loss. Instead, it's disavowed and it's filled in with something else. But, and I have to say, because this is not really mourning, right? You're sort of patching over these feelings, but it's not mourning a loss. The attempt at repairing an empty, lonely feeling does not lead to any sort of resolution. If there is no resolution, you may now be asking, how does this so-called pathological mourning present itself later in life? Let me answer that question with the story of Mary. Let's go back to that. Because eventually, Mary left home, proclaiming that, and I quote again, that her mother was dead to me. She married, and as in many of these stories that I hear, she marries a man who subsequently becomes verbally abusive. Again, if we apply this theory of pathological mourning to understand her toxic relationship, this is an attempt, I would say, if you can imagine this, the abusive relationship is an attempt to revivify the relationship with her dead mother. Remember, she said, "My mother is dead to me." Mary unintentionally, in other words, she does not know that this is happening. She unintentionally finds herself in a situation with an abusive husband. She cannot leave the situation, however, because now all of her mother's love and attention through her husband's abusive, devaluing comments. See, I'm substituting the mother for the husband, right? This is something, again, maybe we could call this a projection or a transference, but the husband comes to represent her abusive, devaluing mother. And this suggests that Mary is not alone. And this feeling becomes addictive. In a prior seminar entitled Effective Techniques for Addressing Personality Disorders in Challenging Patients, I spoke about the psychoanalytic concept, and I'm quoting, of role responsiveness developed by Joseph Sandler, and how this concept refers to the way in which both patients and the therapist unconsciously engage in roles that mirror past relationships and internalized dynamics. This concept, I'm going back to it because it nicely highlights how trauma bonded patients might unconsciously, again, not intentionally, but unconsciously try to impose a role on their partner, reflecting their own internal object relations and earlier experiences. So in other words, these early internalized relationships get repeated. What do you think? Can you imagine that Mary is unconsciously reenacting the earlier relationship with her mother? She is again in the role of victim, and her husband is her abusive mother. What do you think about that? Perhaps an old internalized relationship is being repeated? This, by the way, is one of the ways the pathological mourning that's avoiding loss, that's the way it presents itself later in life. I'm still thinking about the question that I said earlier that I imagine you were asking. Okay, if there's pathological mourning, how do we know this? How does it present itself? This is the way it presents itself. Earlier traumas, earlier relationships get reenacted in the present. Also, Mary tells us that she was being verbally abused and emotionally neglected. She says her husband was talking to other girls and I quote, leaving me all day, and I know he was sleeping with other women. And that would make me feel inadequate. I would do anything, Mary states, to get his approval at any cost. He did inappropriate things to me, she says. I knew it was wrong, but I didn't do anything. Okay, so if you're with me thus far, and you could see and begin to imagine how unresolved past trauma, if not properly mourned and put to rest, gets repeated, let's now pivot and consider how you would treat a patient like this. We see a few things. We have a patient who's not mourning a loss of genuine affection from her mother, and she replaced loss with a stimulating sadomasochistic relationship. And in her relationship with her husband, we speculated that she's repeating this special type of relationship. Perhaps I said that this is role responsiveness, right? It's like a role is getting reenacted. A relationship gets reenacted in the present. It is also important to note that Mary engages in splitting, where she is living in two worlds. There is the fantasy world of the trauma bonding sadomasochistic relationship. That's a fantasy world, right? Because she is immersed, and I'm going to talk about this a little bit more, why this is a fantasy, so bear with me. But she's immersed in this relationship with her mother, right? And getting her exclusive attention. So we could say that's a fantasy. But she's also in the real world. He did, and I quote, inappropriate things to me. So in other words, she knows there's a reality here that she's being treated or something is getting reenacted. Let's put it that way. I like that better. Something inappropriate is getting reenacted in this relationship. Let me quickly illustrate this point on splitting so we could talk about therapeutic interventions. Let's continue with Mary's story. When Mary got pregnant, she and her husband could no longer afford their current place of residence. So, do you want to take a guess where she moved? I don't know if you guessed this correctly, but Mary moved with her husband back into the home of her mother. She thought, in her words, oh my God, she is going to be my mom. I am the golden child. Just a quick reminder, if we go back to the beginning, when we describe the trauma bond, this is where we started the seminar. I mentioned that there is, remember I said a sense of hope, and I told you I would come back to this later, that there's hope that things are going to change. Do you hear the hope here in this trauma bonded relationship? Oh my God, she's going to be my mom. I am the golden child. There's your hope that finally she'll be recognized, appreciated, valued. We also said there's a negative loop that you have no control of, that you try to detach, but you're unsuccessful. And here it is again. We see this with Mary. Mary is back in the loop. After leaving her mother, remember what she said? She's dead to me. She's back. She's back home again. Finally, the third thing we said is you don't feel whole unless you are with this person. So there's a longing, a need for Mary to go back to this relationship, as painful as it is, right? As dysfunctional as it is, she goes back because she doesn't feel whole without her. So let's keep going. Mary reported things were going okay, but then she said that her mother asked her to give her some money so she can purchase alcohol. Mary became furious with her mother, and they got into a fight. Her mother punched her and gave her a bloody lip, which caused her water to break. And this chaotic situation continued right into the hospital. Let's pause again and analyze this. On the surface, this is a tragedy. Mary's a victim who cannot get a break. But I'm asking you to keep in mind that this could be more complicated, right? If we stay rooted in Mary's manifest story, it's going to be impossible for us to think about how to help her break this trauma bonding cycle. So what I'm suggesting is we could start with the manifest story. And if you've listened to any of my podcasts, I always advocate appreciating the subjectively useful component of a maladaptive symptom or story. And I think I even may have mentioned that in another continuing education seminar, because this technique, this technical approach, I could tell you initially is so valuable because in this case, for example, it's helpful to get close to Mary's experience and what she imagined it would be like when she returned home to live with her mother. So that's what I mean by getting close to the patient's subjective experience. We don't want to judge. We don't want to discourage. We don't want to frown upon her decision to move back with her mother. We want to get close as possible and understand it from Mary's perspective. And I think from the content that I just gave you, you could probably understand this a little bit already. There's a fantasy there. The fantasy is of the magical reunion with her mother. Oh my God, she's going to be my mom. I'm the golden child. And this fantasy of the magical reunion is very, very common among individuals who have narcissistic characteristics. Why? Because if there's this magical reunion, there's no loss. Remember, this whole thing is based on the fundamental premise, this whole thing being the trauma-bonded relationship. From this particular perspective that we're examining today is based on what? The premise of pathological mourning, the avoidance of mourning. So if there's a reunion and you're back together, there's no loss. And that's a wonderful compromise. And the more you can appreciate this magical reunion by getting close to Mary's experience, the better placed you are to understand how painfully difficult it must have been for Mary when her mother asked her for money. You see, that seemed like such a trivial incident, But you could imagine for Mary what that represented. What did it represent? This request thwarted and ruptured the illusion of what? Being cared for and loved by her mother. In other words, when her mother asked her for money, that was the proof, right? That was the signal or a sign that mom is not going to take care of me. Mom isn't going to love me. I need to take care of mom. Mom is asking me for something. This quickly turns into a tormented attempt to regain contact through the old way again. How does she make contact with her mother? Through the induction of a mutually addictive misery. So there's the fight. So now when there's a fight, they're back together again. So when you slow this story down and you stretch it out, you begin to hear, and by the way, that's a technique as well. So appreciating the subjectively useful component, getting very close to the fantasy, slowing down the story. What you hear is that when this request was made, Mary said, I was furious with her. And then the focus though was she punched me, right? That's when she focused on the mother punched her. So another technique is if you hear the part that Mary was furious, and that's not easy because that's such a small part of the story. It's a lot easier to talk about what somebody did to you, right? So you don't always hear this stuff, but if you do, that's what you want to begin to pull to the fore. What got you so upset? Let's slow down. Let's go over this. What were you thinking at that moment when your mother asked you for money? What were you thinking and feeling? It is as if in this situation with her mother now, I'm quoting, the complete chaos, right? Mary can now say to herself, again, this isn't conscious, but she could say, if you feel as bad as me, there is a togetherness. See, remember, this brings up the old memories with her mother when they were together and she was getting her exclusive attention. But the goal then is this. See, this is, by the way, the perfect union, but not what she imagined, not the golden child, but now they're in sync with what? Because now they're fighting. They're involved in some chaotic situation. And again, in terms of technique, if you have a patient like this, the togetherness and the separation is something that you can now explore in the treatment. In other words, if you could hear what I'm suggesting, that the focus is to be together with her mother, unfortunately in a destructive way, but it was because Mary could not tolerate the separation. She cannot tolerate the rupture of that image that she had in her mind of the perfect reunion with her mother. The fight, the punching, the complete chaos is all in the service of maintaining an excitement that will keep both herself and her mother alive so that her mother will never again be lost, and I quote, remember she said, dead to me, so that her mother will never be dead to her again. And Mary will never have to suffer the excruciating pain of loss or separation. Before we conclude, I like to bring everything together by revisiting some key points in a fresh way. Recently, I had the opportunity to participate in a live interview on the topic of trauma bonding, and I want to share a segment of that discussion with you. This segment not only provides a different perspective on trauma bonding that I think you'll find insightful, but it also reinforces many of the concepts we've been exploring in this seminar. In the conversation with Bree, we explore the concept of being stuck in a toxic relationship, which she refers to as, and I quote, potential land. This ties back to the themes of hope and the magical reunion that I mentioned earlier. When we cling to hope, we often lose touch with reality. Bree describes this state as having one's head in the sand, while in psychodynamic terms, we might refer to it as the, and I quote, erotic haze. We also delve into the idea of, again, I quote, psychic conflict, emphasizing that the goal is to amplify this conflict to help individuals break free from the haze, the false hope, and see their situation more clearly. Ultimately, Bree addresses the necessity of, and again I quote, grieving. We looked at this in terms of pathological mourning, and I provide a brief example of what the grieving process entails. Without further ado, here's a clip from that interview. If you're interested in hearing more, the full interview is available on the Narcissism Decoder podcast. Bree and I were talking about trauma bonding, and we started with looking at, like, descriptively, what does it look like? And then we spoke about where does it come from? In other words, what causes someone to get sort of entrapped in this kind of toxic relationship? So we described it, we looked at the origins, and then we needed to look at a few different theoretical perspectives, like some theories on why they may get stuck in this relationship. And we were throwing around different theories, one of which was from very early in life, they tend to associate love with pain and suffering. And we gave some examples of that, like growing up with an alcoholic, abusive mother. So that was one theory. The second theory was, Bree, jump in and help me if you want, but I mentioned pathological mourning, right? Mm-hmm. So that was that incapacity to really mourn a loss. And that began to explain how it is that they end up back in relationships. Even if they break one off, they may go back to the same person to which they ended the relationship, or they may end up in another abusive relationship. And again, I gave an example of a woman who left her mother, claiming that her mother was dead to her, but then subsequently ended up in a relationship with an abusive man. And then when times were tough financially, ended up back at home with her abusive mother. And the whole cycle just repeated itself. And the third theoretical perspective, and this is where Bree and I left off, was she called it that sometimes these people present as if they're in a fog. And that really resonated with me because in my field, the field of psychoanalysis, we call it like an erotic haze. And I've discussed this in far more detail in earlier episodes on trauma bonding. But that's where Bree and I left off, because having a good theory in mind really informs, how do we work with somebody like this? Like, how can we possibly help somebody who's in a fog, who's sort of impenetrable in a way? They find it really hard to hear anybody else. And that's where we said, we'll kick it to part 2 and we'll pick up specific tools or techniques that we may find valuable in terms of trying to help somebody get their head out of the sand, if I can use Bree's metaphor on this.
There's so many metaphors. The fog, the haze, the sand. Yep.
But I think the listeners get the sense that overall, they're not really available. They're not functioning in the same reality. They're in their own reality when it comes to this stuff. It's like the person I mentioned who's getting scammed, and people who, loved ones in his or her life are saying, this is a scam. Stop giving your life savings to this person. And they just cannot hear that. So let me just start off, Bree, by asking you, do you have any thoughts? And just for the listeners to know, this is basically what Bree and I were doing, is like, what do you think about this? Or do you have any thoughts about that? So any thoughts about techniques or tools and techniques for someone who's in this sort of fog?
Yes. Well, to quickly recap on the last thing we talked with the specific words. So I was talking about potential land. And that's the way that I, in my practice, describe this place that we go to. We dissociate from our reality into this fantasy place where all of the hopes are coming true about the relationship. So we're not fighting anymore. They've gone to therapy. Maybe we've gone to couples therapy. Maybe we're traveling again. Maybe they're writing me all these sweet love letters again. Like whatever the hope is for the relationship to get back to. we're dissociating to that place, because if I can live in that place, then I get all the yummy dopamine of the anticipation of that coming true. And I don't have to acknowledge the reality that I'm in and feel the grief around never getting what I want that's in potential land. So we stay there out of protection for our ability to feel, to your point, the loss, to feel the grief, to have to actually make the hard decision to leave these types of relationships. And potential land, it's not like a cognitive place where like, okay, I'm going to go to potential land now. It's just a place where our brain is taking us to take us away from the pain of what we're in our reality.
Yeah, no, I could picture it in my mind as I'm listening to you describe it. And if this is a little bit off, just bring me back, okay? But I pictured somebody who has a fantasy that it's like the only if, like if only this would happen. Like, for instance, if they decide to stay in this relationship, it's only if he will, to go back to what we called like, what was it, the love bombing phase, or what I called like the magical union, right? Like if only things can be blissful again. And then finally I will feel like I'm being recognized. And just to loop that in to one of the theories that you and I were throwing around, which was the pathological mourning, you could see how beautifully like this land works for them, because in this land, if they go back to this blissful union with the other, there's no loss, there's no grief, there's no separation. And separation is really painfully difficult, especially for people who are suffering with personality disorders. So all of that can sort of be wiped away just by entering this simple place of the erotic haze or the fog, or, you know?
Yeah. And what I've experienced firsthand in my own healing and in that of my clients is it's not just grief about the relationship ending. That's part of it. But it's grief about who you thought that person was. It's grief about who you were in that relationship, who the dream that you guys were creating that is never going to become real, right? We're grieving so many different layers of things when we let go of a relationship like that. So that makes the stakes even higher to avoid the letting go, to avoid the grief, because there is an onslaught of things that are no longer there that we have to sit in the discomfort of. And if we don't have experience or the tools to be able to be with our feelings in that way, that's a very scary place to be.
So now you're speaking my language, right? Maybe you're not using the same words, but if I could, again, borrow some psychoanalytic jargon, this is a fantasy. So what you're talking about is helping a patient sort of get some space, let's say, from a fantasy that really takes over their life, right? Is that a safe way for me to say it?
Yeah.
Absolutely. So then the question becomes, we want to think a little bit about tools and techniques today. So how do we help somebody come out of this like fantasy world, which obviously is the most important thing in their life?
Yep. Yeah. We help them come back into reality, which means gathering data around reality. So I'll preface this by saying that the person that I take through these exercises has to have some willingness to look at the reality. If their head is so far down in the sand, that's a different...
Okay, let's dwell on that then just for a second, and then I want to hear about the second part, because that's more often the case in the patients that I work with, because that's part of a personality disorder. In part one, I mentioned that they use, and I meant this not in a pejorative way, but primitive defenses, and one of them is denial. The power of denial is immense. So what if they don't want to come out of that fantasy world? Like then what?
Yeah, I would actually push that question back to you. Because most of the people that I'm working with have some desire to start being curious about these things. So with the clients that you work with, it sounds like who have more of the personality disorders, what do you do? How do you work with that?
So if they're not coming out, you have to go in. So I go into that space with them. And prior episodes, I refer to this as appreciating the subjectively useful component of a maladaptive defense or experience, right? So even though we know them being in this relationship is not a healthy choice for them, from a psychodynamic perspective, it's not my job to get them out of this relationship. Of course, as much as I want them to get out, I'm not going to get them out. I want to go in to the space where they are and get in the sand, right, with them, in the fog, in the haze, and understand it from their perspective. Because what I found is until they could feel like someone can really hear them, they're not going to hear anything that I have to say. So presenting reality would be like equivalent to me speaking another language to somebody. It would be like a lecture. They would be getting an intellectual lecture, and they're not going to hear something like that. Mm-hmm. So the first way to do it is to get as close as possible. And I know it probably sounds strange because you're like, someone comes for help. How could you not work on getting them out of this space? And this goes back to something that you said in one of your episodes that maybe is a good place to bring this in, is you said when they make these decisions to be in these relationships, and I'm not quoting you directly, I'm paraphrasing, but it's something like they're going against their own values. I don't know if you remember saying that or if you still feel that way.
Yeah.
Does that sound familiar?
It does. Yeah. And oftentimes they're not really aware of what their values are, but they feel the friction. They feel that something is not aligned, something is not feeling right. And sometimes they have words for it and sometimes they don't. But yes.
Yeah. So the way when I heard that, I was like really excited again, because it's like phenomenologically, you speak of this like very similar things that I see, but we just use different language. So what we would call that is psychic, that there's some conflict, in other words, psychic conflict. But the problem is for my patients, which sound different than yours, is the conflict is not big enough. You see, they don't want to think about getting out of the space. So after we get close to it, the goal is to try to open up some space or to make the conflict bigger. Like conflict is good, by the way, in life, because conflict, when handled well and it doesn't overwhelm us, pushes us forward. So we would want to make that conflict even bigger, if that makes sense.
Yeah. So I think that leads into the exercise that I take my clients through, where we start gathering data around what's happening now. So a lot of times when we're stuck in potential land and you ask somebody, like, what do you like about this relationship? They're like, oh, we used to do this, this, and this, or we're going to do this, this, and this, right? It's in the past or it's in the future. So the exercise that I take clients through is what is happening now or in the recent past that didn't feel good. So we're identifying an experience, we're identifying how it felt in their body, and then the feelings that they had about it. And sometimes this list starts very small or very short. And then as we're going, they're like, oh, there, I thought of another thing. I thought of another thing. I thought of another thing. And then they're starting to see what's happening in real time in the relationship that is in direct conflict with the future that they think they're in or they think that they can get to. So for instance, if part of my personal experience was part of my potential land was that my ex was going to go to therapy and figure out his addiction so that he could be more available for the relationship. And in reality, he was hiding, he was using behind my back. He was talking very negatively about therapy. He was not participating in couples therapy, right? So I had all of these pieces of data showing me that what I hope to happen is very likely not going to happen because these other things are happening. Does that make sense?
Yes, yes. Somehow you had a capacity to separate out like fantasy from reality. We call this an observing ego. Like you can observe. It's like you got a little space from it, enough space that you could observe it and say, this is not what I want in my life. I get this, but tell me a little bit more if you don't mind, because now you have me really curious about your approach with your clients. This thing about paying attention to your body, like, because you and I spoke in part one about how being in this sort of dysregulated, hyper-aroused state is such a critical part of this. It's not, we said, it's not pleasant, but it's gratifying because it's reminiscent and it's like a heightened arousal. And if you and your partner can both get into this place, there's a sense of together. And that's like the blissful place, like the blissful union. But how does this play out with your clients, Bree? Like what happens there? Like what do you begin to hear? I guess that's what I'm curious about when you get them into that space.
It opens the conversation for curiosity because if let's say they're going through their list and they notice that in a lot of these interactions, their chest tightens up and they have a lump in their throat, right? So we're like, oh, that's interesting. Why do you think that specific sensation is coming up every time you have an interaction with this person, when there's a fight, when there's whatever's happening? And even though that interaction feels familiar, the fighting feels familiar, they can cognitively understand that having a tight chest and a lump in your throat means something different, right? The body is experiencing something similar every time, which means that it's coming from a trigger place, a trigger wounded place. Then we can get curious about what the backstory is there. So it opens that conversation instead of, well, just feels familiar. This is just what I know. It helps them have another piece of data around, oh, and my body's doing this. And I know rationally that if I'm in a healthy relationship, my body shouldn't feel tight and clenched and blocked.
Wait a minute. Hold on. You mean not everybody's body feels tense and tight and nobody has a lump in their throat? I'm a little confused.
And sometimes that is the reaction, right? They're like, well, I've lived with this my whole life. What do you mean people don't experience this?
Yes.
So that's another part of the education of, well, you learned relationships a specific way because of your specific past. And this is what a healthy relationship looks like and feels like in your body. But if they've never experienced that, it's foreign to them. So they don't know that this is an abnormal reaction in an attachment dynamic.
Yeah. And just sort of to fill the listeners in again. So one of the things Bree and I were talking about, and please go back and check out that episode if you can, is what happens at this critical point? Like, what if they say, oh, wow, I never knew that people don't walk around with a lump in their throat.
Yep.
But now that Bree is helping me, I no longer have that sensation and I kind of miss it, right?
Yeah.
You see, and again, just for the listeners, what Bree and I were saying is it's very possible that the kind of people that we treat are different. So when you're treating with somebody who has more of these personality characteristics, that is something they'll actually begin to miss. And they may not even be conscious that they're missing it, but they certainly will then try unintentionally to bring this back in their life by creating some conflict or provoking a fight of some sort, again, outside of their awareness, or they return to the abusive relationship, even though they were free of it and things look very promising. They just couldn't bear to be without that Nope, it's not about the person, you see? So Bree said that a little bit earlier. They cannot bear to be without that lump in their throat or that tightness in their body. See, that's what's really missing. It's not the person. Because objectively speaking, like when you wrote things down, right, Bree, you saw it wasn't about the person. And maybe some of your clients see this too, but then it's like, okay, so then what are you really missing here? Like what's going on? Which is a little bit more characteristic of the work or the things that I bump into in my practice with these people. Yeah.
Which comes back to grief, right? If we're having this epiphany moment of, oh my God, I've only ever lived with a lump in my throat and tightness in my chest. Then I have to grieve that that's been my experience. And I have to grieve that I didn't have a healthy dynamic in my childhood. And I have to grieve wherever the root was of learning this is how relationships are. Yeah. And that is hard. That is hard to look at. It's hard to be with. It's hard to feel. It's hard to have the tools to be able to feel that in a healthy way where you don't shock your nervous system into going back into the familiar. Right. So having a space holder for that process is vital if you don't have those skills. But it comes back to being able to acknowledge the loss, grieve the loss, so that we're not to your point in the last episode, we're not in the compulsive,
repetition compulsion.
Yeah. We're not in that cycle. We're not constantly trying to fix the past with the current.
To help somebody get into sort of a more reflective, regulated state of mind.
Yep.
And that's always like the first level of business is to help someone get in a place where they can begin to reflect. And once they can reflect, this sadness might come up. And rather than splitting it off or projecting, whatever you do with it, then we begin to integrate it into it becomes part of our personality.
Yep.
And that's one of the key characteristics of working with personality disorders because they're thought to have a fragmented sense of self. So the goal is integration, and we want to integrate mostly feelings that are intolerable. And what you just described very nicely is by slowing them down, getting them into a more regulated state of mind, getting into feelings that they had not had access to before, is a way to begin to integrate parts of their personality that were previously split off and projected. In conclusion, our exploration into the intricate dynamics of trauma bonding relationships viewed through the lens of a psychodynamic perspective reveals the profound impact of the repetition compulsion. Again, this is just a fancy psychoanalytic concept, but that means the repetition compulsion means history repeats itself. There's a relentless drive to repeat destructive patterns, often trapping individuals in a perpetual loop of stasis. Nothing changes. That's the part that I emphasized earlier. Mary returns back home. She separates from her mother, but she ends up moving back. And not only does she move back, but the whole early relationship gets recreated. So what I'm suggesting, which is a radically different way from what you may typically hear about trauma bonded or sadomasochistic relationships, is the avoidance of confronting loss creates a paradox where the absence of mourning hampers the potential for personal growth. In other words, you may have heard this old saying, nothing lost, nothing gained. So there's no loss here. And if there's no loss, there's no forward movement in life. Creating a split world requires the suppression of genuine emotionality, resulting in the substitution of a sadomasochistic, trauma-bonded relationship. I hope I have challenged you to think about this type of relationship as a defense against a profound sense of inner aloneness and deadness rooted in what? Rooted in a deficient early parent-child matrix. I encourage you to reach out with any questions or comments regarding these complicated processes. This topic is undeniably complex, and if there's anything I discussed that requires further clarification, please do not hesitate to send me an email. I would really appreciate that. Additionally, I have supporting resources available, including recorded podcast episodes and videos on narcissism and narcissistic relationship dynamics. These resources can be accessed through my website, which is linked below. Okay, until next time, engage your mind and continue exploring the depths of psychodynamic theory and techniques to enhance your practice and support your patients. Bye for now. Disclaimer alert. This continuing education seminar is provided for general informational purposes only. The content presented is not intended to diagnose, treat, or cure any psychological conditions related to narcissism or any other mental health issues. The information provided in this seminar should not be considered a substitute for professional medical advice, diagnosis, or treatment. For specific advice or treatment related to personality disorders or any other psychological conditions, please consult with a qualified healthcare provider.